University Medical Center in Las Vegas is the only level 1 trauma center in all of Nevada. The hospital is capable of treating a wide range of patients 24 hours a day. Its staff treated many of the wounded from Sunday's attack. Dr. John Fildes is the Trauma Center's medical director. Good morning, doctor. Thank you so much for joining us.
Good morning.
I know that you took in more than 100 patients yesterday. The scene there was described as a war zone. How did you deal with it?
When we were notified of the shooting, we went into our disaster plan and went through the phone tree, and we brought in staff, many surgeons, anesthesiologists, nurses, techs. And as the flow of patients started to rise, we were able to assign them to teams and to move them through the resuscitation area. And then we opened up new parts of the hospital as hospital wards, and we were able to get them in beds and continue their care.
Describe the type of injuries.
We saw mostly gunshot wounds, but we also saw injuries that were sustained and people fleeing the scene. For example, some people had fallen, others had been pedestrians struck by vehicles in the chaos. And so as they came in, we sorted them out along those lines.
Can I ask you at this point, how many of the patients that you've received, how many of them are still on the critical list? What's their condition?
About a quarter of them are still considered critical, and we've downgraded 3/4 of them to stable condition at this point.
So what's the total number of that still in critical?
That's going to be about 25.
25, about 25 critical. What are the types of recoveries and operations still needed for those in critical condition?
Well, they can include operations on the abdomen, ongoing care for penetrating wounds in the chest. There are a number of patients who had vascular injuries in the extremities that are still being watched and worked on, and there are a fair number of orthopedic injuries that have to be managed.
I understand that it just so happens that UMC recently consulted with doctors and physicians from Orlando. What were some of the lessons learned?
We received a presentation from the doctors in Orlando as part of a combined program with Metro to understand what the in-hospital experience was after the Pulse nightclub shooting. And it gave us a different frame of reference to work from. When we combined that with our regular disaster drills, it created a really good platform for us to work off in this situation.
And how are the staff members of UMC doing?
You know, when you walk around, they're all really tired, but they're just beaming with pride right now.
For Dr. John Fildes, I know it's been a long, almost couple of days now, so thanks to you and all of your staff there at the hospital. Thank you so much.
Thank you.